What is ST segment elevation myocardial infarction? This is a particular type of heart attack where the artery supplying a particular part of the heart muscle is completely closed off. And so because of that complete blockage, not just a partial blockage, but a complete blockage, the downstream tissue that's supplied by that artery is not receiving any blood at all and is potentially dying with every minute that elapses between the treatment, from the onset and the treatment of that illness. The signs and symptoms of STEMI can be varied. The classic presentation is one of somebody who has pressure across their chest, or the sensation of somebody sitting on their chest, or an elephant sitting on their chest. It can also be associated with radiation of that pain to the jaw, arm, or neck, although other atypical presentations are also seen, such as burning chest pain or other sorts of chest pain, shortness of breath, upper abdominal pain, or severe fatigue even. So there are many different ways in which this illness can present. Heart disease in general is extremely common in this country, as we all well know, and heart attacks are the #1 killer of both men and women. Louisiana in particular has a very high incidence of heart disease, and so the patients who are at risk for heart disease and heart attacks in general are those who have what we would consider typical cardiovascular risk factors. These are things such as high blood pressure, diabetes, history of smoking, history of a family history of early heart disease in those patients. So a lot of folks within Louisiana are at risk for this condition. The role of EMS and 911 in this process is absolutely critical. Because EMS is able to perform EKGs in the field, deliver certain medical therapies such as aspirin, identify patients who are having this type of a heart attack, and identify the right facilities to take care of these patients out in the field, that really makes a huge impact in terms of time to treatment that we're able to achieve using EMS. So any patient who is suspecting that they might be having a heart attack really ought to call 911 and take an ambulance to the hospital, receive treatment along the way, and also allow the receiving hospital to take care of those patients, get ready to take care of those patients while the patient is being transported. The definitive treatment for ST segment elevation myocardial infarction, or STEMI as we refer to it, is to restore blood flow to that artery that's completely blocked off. And there are a couple of different ways in which we can do this. Because the blockage has been caused by a blood clot, the treatment is either to break open that blood clot using clot-busting drugs, or using a balloon and stent to open up that artery and restore blood flow downstream. This would be the equivalent essentially of taking a pipe that had narrowed and reducing the plaque or sludge that had built up within there. Because of the time-critical nature of these blocked arteries and the need to restore blood flow quickly, the Louisiana Emergency Response Network, which is a state agency, is working with hospitals across the state to create an organized system of care for the entire state to treat this time-critical illness. Because heart tissue dies with every minute that elapses from the moment that these arteries are blocked, the faster we restore blood flow to these arteries, the less heart is damaged and the less chance that the patient is going to have a bad outcome in the long run. Every minute matters, and the treatment strategy, depending on whether it's clot-busting drugs or balloons and stents, need to be provided in a very short time period, 30 to 90 minutes from when the patients call 911 and seek medical care. And our efforts through LERN and through the STEMI initiative are to identify the hospitals that are best able to provide this care, identify the areas of the state that are covered or in an appropriate geographic distance from those hospitals, and get patients to the right place that they need for the right care at the right time. As part of the LERN STEMI initiative, what LERN has done in collaboration with hospitals around the state is to identify which hospitals are capable of angioplasty at all times and which don't have these protocols in place and these resources in place 24/7. The map shown here highlights the areas that are within the appropriate drive time for these angioplasty-capable hospitals, where patients should be preferentially transported to those hospitals in order to receive the best care. Hospitals lying outside of these areas might need to consider an alternative strategy of clot-busting drugs in order to take care of patients as well as possible. To simplify the appropriate triage of patients to the best possible place for their care, LERN has worked with hospital providers and pre-hospital providers to create a workflow and bypass protocol for appropriate routing of patients to angioplasty centers where they're nearest available, and to the next best place when those are the appropriate places to go.